Hey folks, it's Dr. Mike, and good afternoon to you wherever you are, and thank you for watching this video. Now, this is another 30 for 30, so it's October 22nd, so it's our 22nd 30 for 30. And in our 21st session, we looked at a flow chart for managing the medical exercise training client, just the overall management process with those clients. We realize for those of you that are transitioning from personal training or really getting started in medical exercise training, this is a different ballgame. There are a lot of T's to cross, a lot of I's to dot. And in our last video, we summarized this whole flow chart. And I know it looks like hieroglyphics, but it actually has a lot of information here that you need to start following through on to really make sure that your programs are effective. We cover all the bases, nothing falls through the cracks, and most importantly, for communication with medical professionals and to make sure we have a safe and effective exercise program. So as I said in our previous session, we're going to go over the initial contact and the initial session. Now, this initial contact is just that, the initial contact with the client. This should be by a phone call. Now, it may be started with an email or a text message. Client wants to come in and see you. Maybe they contact you through your website, so it's an email or a text message. But eventually, that initial contact should be by phone. In that initial conversation, we want to determine the client's medical condition or their diagnosis. Now, clients will be somewhat confused in some instances with regard to what their condition is. Maybe they have multiple conditions, they're going back and forth with 2 or 3 different conditions, or maybe they aren't coming directly from a doctor, therapist, or chiropractor, and there's some confusion with regard to long ago they were diagnosed with something, but they're not 100% sure what it is. So you've got to have that conversation with them to determine what their condition is, and if there is a referral source, determine who that referral source is. Is it a physician? Is it a physical therapist, a chiropractor, a nurse? Who's the referral source that you may need to communicate with? Also in that conversation, you need to determine the client's medical exercise training needs. Now, do they need a group program, or do they need one-on-one services? Or do they maybe need eventually a medical membership? Or also look at it this way, over the course of the next, say, 90 days, if the client progresses the way that you think they will, based on your experience with their condition, what will the client need? They'll maybe need initially one-on-one training, there may be some group exercise, there may be a medical membership, and then maybe some home exercise. So you just start to kind of, sort these things out in your mind as you're going along. Also at this point, you should do an anatomy review. Now remember, every aspect, everything that you do in medical exercise training, as well as everything that's done in every aspect of medicine, whether it's physical therapy, occupational therapy, or actual medical care or nursing care, is based on an understanding of clinical anatomy, and then how that anatomy is affected with the disease process now is the pathology. So we go over this extensively in our medical exercise specialist training series, understanding the clinical anatomy and pathology of these conditions. And this is something that in your mind you should have a thought process on and understand the anatomy, so that when you do come time to work with that client, you'll understand the relevant anatomy and pathology of their condition. So that's something that you may do during the conversation, just kind of as a background thought in your mind, or something that you may do once the conversation is concluded. Also in that conversation, you're going to determine who you need to communicate with regard to the physician, the physical therapist, or the chiropractor. And that takes us to an important point. We want to make sure that as a medical exercise specialist or medical exercise professional, you understand that you're not providing physical therapy services. You're not now trying to provide the services that a licensed therapist, chiropractor, or physician would provide. You're augmenting the services that those individuals provide. When we started this back in the 1990s, we realized then that the change in healthcare reimbursement, insurance reimbursement, was going to continue, and we see that now here in 2018. It's getting worse. Therapists are now faced with moving their patients out of the clinic faster to become your client, and with that, you've got to determine now who you need to communicate with so that the transition is safe, effective, and most importantly, it doesn't cause any harm for the client. So that communication becomes important. We want to establish who we should communicate with in that initial contact with the client. Also, once we've gotten all the information, now we're going to schedule the client for that initial session, and you schedule the date and time. And with that, you're going to go over the fee structure that you have in your practice, and also how the payment should be made or what you're expecting as far as payment. And then also advise the client on the proper attire to wear, the clothing to bring, so that you can get a good assessment and they can have a good and safe and effective exercise session. So you can see this initial contact is important, that initial conversation. Now we move to the initial session. So now the client is actually coming to your facility for your services. Now, in this initial conversation, you made it clear that you were a medical exercise professional, a medical exercise specialist. You made sure that there is no misconception that you're providing any physical therapy services. So now once they get to your facility, again, we're going to reiterate that. But now, with that initial session, the beginning of that initial session involves paperwork. Everything you're going to do, folks, with regard to managing this medically based client now is a lot more paperwork. So here you'll see we have admin forms. You're going to need the client to fill out a demographic form, just basic information on themselves, emergency contact, address, phone number, email address, all that kind of good stuff. And then you're going to ask the client to fill out a release of liability form. And remember, folks, the release of liability form isn't worth the paper it's written on. From the standpoint of if you do something that is unprofessional and is not appropriate for the client, I don't care what you do and how many papers the client has signed, it doesn't make a difference. So the release of liability form really is going to protect you only if you've done what's professionally reasonable and prudent. The release of information form, though, becomes important because you now have to have authorization from that client to communicate with their doctor, therapist, or chiropractor. With this release of information form, you want to also note on the form what specific information you need from that medical professional, because a lot of clients are reluctant about you having access to all of their medical records. So in this release of information form, before the client signs it, you may want to note specifically what you need. Is it blood pressure information? Is it information on maybe an x-ray of a particular region of the body? Maybe an operative report? So you may want to look at specifics. Along with that, you're going to determine the method of payment, and this is done when the client comes in the door. So a lot of this paperwork is done maybe if you are in a facility, the receptionist is doing it, or you give the client the paperwork and they're doing it while you're sitting nearby if they have any questions. But the payment, we need to make sure that that's covered. And then insurance. Now, let me make it clear. Insurance reimbursement for medical exercise training services is legal and it is ethical. But you have to make sure the client, the referral source, the insurance carrier all understand you're not providing any physical therapy services, you're not a physical therapist or a chiropractor or an occupational therapist. You're a medical exercise professional providing these services. And we even have a video in our MedX Pro 360 area where we talk about the 5 criteria to get insurance reimbursement for medical exercise training services. So we want to make sure that you do get over there to MedX Pro 360 and look at that video so you understand what your responsibilities are and what the criteria is. Medical exercise training is not to be used in lieu of the services of a physical therapist, chiropractor, or physician. So now with this insurance reimbursement aspect, you want to make sure you get a copy of the client's insurance card, make sure you have a written referral from the medical professional, and you're going to have to actually complete your assessment so you establish goals, both short-term and long-term, how often, how long you're going to see the client before you begin to communicate with the insurance carrier. So to some degree, you've got to go through the assessment and the post-assessment process to even begin to communicate with the insurance company. But please make sure you understand you need to get prior authorization from the insurance company to determine if they're going to pay for the services before the client gets started with exercise. Now, one session for the assessment is fine, but multiple sessions of exercise, if they don't pay, now the client is, you're looking at the client to pay and they don't have the money, that's kind of an error. And one thing I've always told our MESs is, no one in the history of mankind has died from acute lack of exercise. It's chronic lack of exercise. It's the 4 or 5 years before that they get an exercise. If you see the client on Tuesday and they don't come back until Friday while you're trying to determine what the insurance carrier is going to do, that's fine. It's not going to detrimentally affect the client. It's going to just simply say, hey, 3 days, we're going to find out, because that's the same thing that happens in medical facilities, particularly when we're waiting for surgery. Clients have to wait for a period of time until the insurance carrier authorizes. So again, you can see the initial contact and the initial session are vitally important in getting the information necessary so you can commence the program, getting the information necessary so you can now have information on the client. But please make sure with this information, you put it under lock and key, it's protected so you are following and adhering to HIPAA guidelines. Most importantly, understand that all of this information is private for the client, okay? Now, we'll be back tomorrow. We're going to talk about the assessment and the post-assessment components in our session tomorrow. Again, please, if you would, go over to medxpro360.com and check out our community for medical exercise professionals. And in that community, we'll go over even more flow charts for different areas of medical exercise training systems. So thanks for listening.